Hi everybody. Several days after recovering from COVID-19, the patient complains of an intense headache, pain in the sinus area, the right eye, blurred vision and swollen cheeks. An endoscopic examination revealed discoloration, a blackened area around the nasal sinuses. The disease progresses rapidly and attacks blood vessels and live tissues in just 3 days. It can spread to the eyes or the jawbone. Once it spreads to the brain, the fatality rate is over 50%. It is sad to think that people who have gone through the immense distress of COVID now have to deal with this severe disability as well. Even as a deadly second wave of COVID-19 ravages, doctors are now reporting a rash of cases involving a rare infection among recovering and recovered COVID patients. It is called the black fungus and it can be deadly. Indian Council of Medical Research and India's Health Ministry issued an advisory calling for better awareness, screening and management of mucormycosis, a rare but dangerous fungal infection. The symptoms of mucormycosis are mild at first and can often be missed in the initial stages. What is mucormycosis? Mucormycosis is a very rare infection. It is caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It is ubiquitous and found in soil and air, and even in the nose and mucus of healthy individual. It affects the sinus, the brain and the lungs that can be life-threatening in diabetic and severely immunocompromised individuals. Doctors believe mucormycosis may be being triggered by the use of steroids, a life-saving treatment for severe and critically ill COVID-19 patients. Steroids reduce inflammation in the lungs for COVID-19 and appears to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronavirus. But they also reduce immunity and push up blood sugar levels in both diabetic and non-diabetic COVID-19 patients. It is thought that this drop in immunity could be triggering these cases of mucormycosis. Diabetes lowers the body's immune defenses. Coronavirus exacerbates it, and then steroids, which help fight COVID-19, act like fuel to the fire. Doctors say they are surprised by the severity and the frequency of fungal infection during the second wave, compared to some cases during the first wave last year. Patients suffering from the fungal infections typically have symptoms of stuffy and bleeding nose, swelling of and pain in the eye, dropping of eyelids, blurred and finally loss of vision. There could be black patches on skin around the nose. Researchers say most of their patients arrive late when they are already losing vision, and doctors have to surgically remove the eye to stop the infections from reaching the brain. And strangely, the fungal infection is affecting a lot of young people. Individuals are infected after inhaling fungal spores found naturally in India's environment and soil. For most people with a healthy immune system, exposure to fungus really won't matter. Mucormycosis is an opportunistic infection. Before COVID, people were far more likely to contract it only if they were in a situation where their immunity was weak. Say, after an operation, a prolonged hospital stay, or an organ transplant. But today, COVID-19 has weakened immunity considerably, leaving more people vulnerable to the disease. As the pandemic rages, if the hygiene in the homes is not adequate, Then the damp surfaces can breed the fungal spores, exposing patients when their immunity is most compromised. Our living environment has changed substantially. There is therefore a greater need to support our health and well-being, primarily our immune system, at different stages throughout our life. These concerns regarding immunity have become more important. 5 ways to boost your immune system. Maintain healthy diet, exercise regularly. Hydrate, hydrate, hydrate. Get plenty of sleep. Minimize stress. And finally, one last word on supplements. Supplements can play a major role in developing your immunity. Thank you.